Hello everyone, my name is Dr. Muhammad Al-Sheikh Hassan, and today I'll be presenting this short session about principles of epidemiology. As an outline, we will be discussing what is epidemiology, core concepts in epidemiology, different applications of epidemiology, as well as types of epidemiological studies that can be found in the literature, and what are the key measures of epidemiological studies. And we will conclude by discussing why epidemiology is important in nursing and why nurses need to understand the basics and the principles of epidemiology. So what is epidemiology? Epidemiology is the study of how diseases affect the health of and illnesses of population by focusing on understanding of the frequency, patterns, causes of health states related events or diseases or condition. So when we do epidemiological studies or when we read epidemiological studies, we need to ask set of questions. These questions include who is affected, like which population, where is the disease or the condition occurring, the spread of the disease or the condition. For example, when we talk about pandemics, why and how is it happening, the causes or initial risks that cause this pandemic or this disease to happen. And finally, what can we do to control or prevent the whole thing, including prevention, intervention, and prevention measures. And when it happens, we control or how to control the whole thing. So this is basically a very brief overview of epidemiology. However, there is a big or a more formal definition of epidemiology, which includes all the elements and the components of the field. So if we look here, epidemiology is the study of the distribution and determinant of health-related states or events in a specified population and the application of this study to control health problems or health issues. If you look at these highlighted elements within the definition, these include the major aspect or the main aspects of epidemiology. So which means we do a study in order to understand the distribution and determinants of health-related states or events. So when we say health-related states or events, we mean general health-related conditions, either chronic, acute, infectious, or non-infectious, or maybe injury-related condition. So the aim of this is to understand these things. So we do apply our understanding in order to control or prevent the problem initially from happening. There are different types or aspects also within the epidemiology or epidemiology itself. For example, epidemiology can be about infectious diseases, focusing on tracking and preventing the spread of pathogens and viruses. And for example, the coronavirus that has happened recently. The other example is chronic diseases epidemiology, where the focus is about or on the origin or treatment and prevention of chronic conditions such as diabetes, obesity, or cancer. The other form of epidemiology is environmental epidemiology, where the focus is on how external factors such as pollution, housing stress, or other nutritional related problems affect the health outcome of people or certain populations. And the other form of epidemiology is about violence and injury epidemiology, where the focus is on about addressing unintentional and intentional injuries across lifespan. This can be dedicated or across one single group or different groups comparing the outcomes of certain intervention and certain strategy. So simply, this is epidemiology. So we aim to study diseases, understand their distribution, risk factors in order to make appropriate interventions and provide enough policies to control or prevent the further escalation of such conditions. So now we understand the definition of epidemiology. We need also to illustrate or highlight what epidemiology can do and cannot do. In the first place, epidemiology can help identify risk factors for diseases and link them with, for example, genetics, environment, or whatever risk factors. Also, epidemiology can inform health policies and interventions. So through epidemiological studies, we can provide recommendations to create or to generate new health policies that aim to improve the quality of life of people. Also, epidemiology tracks the spread of diseases. For example, in the case of pandemics, we can understand the magnitude of certain diseases. Is it bad? Is it good? Is it high or is it low? Also, through epidemiology, we can guide clinical practices and the decision we do as clinicians when it comes to treat our patients. And later, we will provide more examples on how things relate to clinical practice. On the other hand, epidemiology cannot do or cannot diagnose diseases in individual patients. So epidemiology is about the population, not about individual or single patient. Epidemiology cannot provide definitive treatment plans. However, epidemiological findings and data can contribute to align our decisions and help treat our patients individually, but there is no direct involvement of epidemiology when it comes to treatment plans. Also, epidemiology cannot or do not offer individual patient predictions, such as what might happen for this patient, the likelihood for this patient. However, it's all about the population and the greater community. Let's look at these examples now about the uses of epidemiology and how epidemiology can help do these things. For example, identifying risk factors for diseases. This is a study that was published in 2019 by Sheikh et al. It was about the short-term risk factors for a second hip fracture in a UK population. So in this study, after collecting relevant data from that population, they could identify the factors or the risk factors that contribute to a secondary fall or a secondary hip fracture among that particular population. As you can see here in this table, these are the factors. And when we read the statistical data, we could understand which factors are relevant and which factors are not. So through epidemiological studies, we can identify these factors which affect the total population or the whole population, not individual cases. Another example on how epidemiology inform public health policies and intervention. So this study was published 2017 by Voch et al. So this was about public health intervention at a local alcohol licensing platforms. So when they introduced these strict local licensing or alcohol licensing policies, they observed a drop in hospital admission and crime rates in that specific area or that specific population. So this example illustrates how epidemiology can contribute to improve the overall health of the people when we introduce new public health intervention as well as public health policies. This example is about the track of a disease spread. For example, in 2020, Burton et al. Published this evaluation study to see the effect of COVID-19 outbreaks in care homes in the UK. So this included 189 care homes, and they could understand the impact that the outbreak of the coronavirus had on the mortality or death of care home residents. For example, this graph illustrates the increase of COVID-19 related death compared to other all forms of death in those participated care homes. So through epidemiology, we could understand that the impact of coronavirus spread was in that way increasing the likelihood of death or the association of death for those care home residents compared to other causes of death. One final example about the uses of epidemiology on how epidemiology can guide clinical practice. So this study was published by Duffy et al. In 2020, which compared the effect of establishing a early mammograph for women at the age of 40 compared to the usual practice, which is the age of 50. So if you look at this graph, you could see the difference in the mortality rate or the death rate between the two groups. So for this woman in the interventional group who attended an early mammography at the age of 40 compared to the woman who did the standard practice, which is doing the mammography at the age of 50. So there was a big difference or slightly significant difference between the two groups, which means through epidemiological studies, we could impact the clinical practice and help changing the clinical guidelines. For example, in this case, rather than doing the mammography at the age of 50, starting doing this at the age of 40. So we can save more lives. Now let's talk about the core concepts in epidemiology. So in order to understand epidemiological studies and do better implications for these studies, we need to understand their core concepts. For example, the first one is incidence. When we say incidence, we mean the recording of new cases of a disease or a condition in a population over a specific period of time, in a year, or in a month, or a week, for example. Prevalence, on the other hand, is the total number of cases, new and existing cases in a population at a given time. So this includes everybody diagnosed with a disease within this particular year and all previous years as well. Mortality is the death rate from a specific disease or a specific condition, and risk factors are variables that increase the likelihood of disease. For example, in the case of smoking, lung cancer, genetics, and heart diseases. So when we do epidemiological studies, we could understand the relationship or the association between these risk factors and the risk of happening or the likelihood of the outcome, which is, for example, lung diseases or cardiovascular problems. So these are the main core concepts of epidemiological studies, which almost every epidemiological study revolve around. So there are set or like wide range of applications for epidemiological studies in our life. For example, in public health, epidemiological studies identify the causes of diseases. We have discussed this already, and they develop strategies to prevent them. In clinical practice, we inform guidelines. We help modify guidelines for treating patient and managing types or certain types of conditions and diseases, as the example in breast cancer and the early screening of women. For research, epidemiology helps generating hypotheses and studying diseases dynamic or disease dynamics. In this case, we assume things that certain treatment or certain intervention might improve the quality of life or the health outcome of certain people. So through epidemiological studies, we test these hypotheses, which are assumptions, basically. And finally, epidemiology as an application contribute to providing data for health services, planning and allocation of resources. For example, if we know that there's a spread of disease or condition or an outbreak in one particular place, we help allocate more resources to that area so we can control and prevent further escalations of the disease or that condition. So now we understand the application and the core concept of epidemiology, but what are the specific types of epidemiological studies? We have covered this last week when we discussed the different types of quantitative study design, but in general, there are three main types of epidemiological studies. The first one is descriptive or are descriptive studies, which aim to describe the distribution of diseases. Normally, when we are interested to understand the magnitude of a problem or the proportion of people living with a problem, we do descriptive study. For example, studying patterns of an injury in a particular place or city. We wanted to understand the percentage of people affected by that injury or different types of injuries. So we do describe these things as they are happening. The other form of epidemiological study is analytical studies, which aim to investigate the causes of diseases. So we go back to the risk or we follow patient to the future to understand the possible outcomes. For example, in cohort studies, which we discussed last week, we follow people or group of people over time to assess the outcome that might happen in the future. On the other hand, for case control studies, we compare people with diseases, which are the cases, to those without the cases. And we go back to their history and see which one of these groups were affected or exposed to the risk factors or initially had the risk factors, so we can link them together. The other form of epidemiological studies are the experimental studies, when we do some sorts of experiments or intervention. These aim to test the effectiveness of interventions. For example, when we randomized patient in trials to test new vaccines or new intervention, we manipulate the exposure for these patients. Then we say there is a link or there is no link between these intervention and the outcome of these patients. So to discuss or to understand epidemiology further, we need to understand its key measures. So there are a set of measures as well, which have also been covered in previous lectures and will be also through the demonstration in the in-person lecture. The first one is the relative risk. In this case, we compare the risk of disease in two different groups. For example, risk of heart disease in smokers versus non-smokers. You could say the risk of disease is 2 to 1 or 3 to 1 or 4 to 1 as a ratio, right? Compared to people who smoke and people who do not smoke. Odds ratio is another measure, epidemiological measure, that compares the odds of a disease in exposed versus non-exposed, commonly used in case control studies when we go back to the history. So we could link between the outcome that we have now with the previous exposure or risk factors happened in the past. So we test the association between the outcome we have now to what happened in the past. And the hazard ratio is other example, which is used in survival analysis to compare the hazards of an event between the groups over time. For example, the survival rate of a certain group of people after being diagnosed with colorectal cancer. That can be in a percentage. So why epidemiology is important in nursing? Through epidemiological studies and epidemiological data, as nurses, you could understand trends of diseases. So you understand the magnitude of diseases and the conditions that might need to be treated within hospitals or communities. Through epidemiology, we use evidence to inform patient care. We can allocate resources appropriately according to the epidemiological data that we have. We could also advocate for public health measures to be taken, such as intervention, community intervention, or public health intervention. Also, we stay updated on diseases, outbreaks, and emerging health threats. So these are the main implications of epidemiology for nurses, and why do we need to keep them in mind. As an example, knowing how the flu spreads in a healthcare setting or healthcare settings helps nurses implement better infection control practices. Finally, as a conclusion, so epidemiology provides a foundation for public health and disease prevention through data. So we make better decisions in order to prevent and control the diseases once they happen. Also, it helps healthcare professionals understand diseases, disease patterns, risk factors, and effective intervention. This is very important when we provide health education for our patient and provide them with advocacy and guidance on how risk factors might affect their future health. So as a future nurses, understanding these epidemiology component or epidemiology is key to improve patient care and the public health outcomes, integrating your nursing knowledge, your nursing skills with the potential that can be utilized through epidemiological findings and epidemiological results. This concludes the short lecture, and these are the references which you can follow in order to check the resources and read them in full. Thank you for listening, and I will see you next when we discuss TBI and colorectal cancer epidemiology.